Hello, I'm Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness, global leader in driving retinal degenerative disease research. On March 20th, 2024, Dr. Rachel Huckfelt and Dr. Rochelle Lynn delivered a robust presentation on the best clinical practices for patients with an inherited retinal disease. Following is an excerpt from that webinar. Low vision resources are essential in the care and management of patients with an inherited retinal disease. During this episode of A Path Forward for IRD and Dry AMD patients, Dr. Rochelle Lynn will provide an overview of low vision resources and rehabilitation, as well as the impact these resources have on the vitality of patients with low vision or blindness due to a retinal degenerative disease.
I'm excited to introduce Dr. Rochelle Lynn, ODMS, FAAO. Dr. Lynn is Assistant Professor of Optometry at Southern California College of Optometry at Marshall B. Ketchum University. Dr. Lynn teaches low vision rehabilitation and genetics at SCCO. She also provides patient care for low vision patients and genetic testing to patients with inherited eye conditions. Dr. Lynn received her doctorate of optometry and Master of Science in Visual Sciences at Southern California College of Optometry.
Thank you. All right, low vision resources. So I work within the low vision department at our university associated with Ketchum Health Clinic. And within that clinic, we do all of our testing for patients with IRDs. What does that low vision evaluation look like when you refer a patient over? Well, number one, we're going to get a very thorough case history. This can include the family pedigree, but it also includes things such as the patient's goals. Where are they going to school? What are they studying? What types of things do they want to accomplish within their work environment, for example? So we really get the opportunity to get to know the patient. Number two, we are not using charts that the patient cannot see. We want to focus on what the patient can see. So we will have large print charts, such as the Bailey-Lovie chart or the Feinblum chart, so that we can assess the vision as thoroughly as possible. Instead of refracting the patient behind a phoropter, as we might with a patient who has 20/20 vision, we will typically do a trial frame refraction. And there are many benefits to this. One of the main benefits is that we can show larger lens changes. It's going to be very difficult for a patient who has vision loss to select between a quarter diopter lens change. So we'll do larger lens changes based on their visual acuity. Behind the trial frame, it's also more realistic for the patient. They're not behind an instrument. If the patient has a head tilt or a high prescription where the vertex distance makes a difference, or if we even want to trial add-ons such as special tints or telescopes, we can do that within the trial frame. After we find the patient's best corrected visual acuities, then we will go on to device demonstrations. That device demonstration will then include training for the devices that we recommend, and we can also include filter and lighting assessment. So let's show you some of the devices that might pop up within that low vision evaluation. Of course, we have our traditional near magnification devices that are very commonly seen, such as our handheld magnifiers and stand magnifiers. Typically, over-the-counter ones come in lower powers and they might not have good optical qualities or lighting. So we are showing the patient magnifiers that may be much more powerful than the ones they can get over the counter. Traditional distance magnification devices include our handheld monocular telescopes, binoculars, as well as bioptic telescopes. So on the right side, we have an example of a bioptic telescope where the patient is able to look through the carrier lens when they're driving, for example. And then when they do need to spot read something that's a little bit smaller, they can tip their head to look through the magnification portion of the telescope. Filters. There are different light filter colors that we may recommend or trial with the patients. For example, for enhancing contrast, yellow can help some patients, and there are specific colors for particular eye conditions. For example, red colors for patients with achromatopsia and cone dystrophy. Then we get into the more high-tech devices. For example, our CCTVs, portable digital magnification devices, tablets that are specifically designed for low vision, optical character recognition software, so that's our text-to-speech software, and then also wearable devices that include magnification and contrast enhancement. Nowadays, a lot of our younger or more tech-savvy patients will use cell phone apps, for example, Seeing AI cell phone app, to be able to use the text-to-speech software on that. And sometimes simple is best. For example, if I have a patient who just wants to play bridge, I might ask, has she just tried larger print playing cards? There are many large print everything that you can purchase online. For example, these large print keyboards or large print clocks, and sometimes other recommendations to the patient that they might not have thought of. For example, if they're having difficulty chopping white onions, why not try using a black cutting board for contrast? Where can you find these low vision resources for your patients? Here are some options. On the American Optometric Association's website, there is a Find a Doctor resource where you can select for practice service of vision rehabilitation or special emphasis of low vision and rehabilitative vision. So that is one place you can search for doctors of optometry who do low vision within their practice. Of course, there are many organizations such as AFB, American Foundation for the Blind, that list a lot of resources, as well as state agencies for the blind, such as the Department of Rehabilitation. We might not do everything in-house at a low vision evaluation. For example, we send referrals out for many different types of training. One of them is orientation and mobility training. You may hear this as O&M. Orientation and mobility training includes training on proper white cane use, and also patients would then prepare to learn how to use a guide dog or a dog guide. If patients do qualify to have a dog guide, there are specific and special schools that they would go to where they would learn to use a dog guide. We do have patients who drive, and many who drive very safely. For these patients, we can recommend driving assessment and training. These training facilities, some of them have both simulated behind the wheel assessments and then actually within a car with an occupational therapist or driving instructor training. This can also include bioptic training if that is something that the patient requires for driving. And of course, we're happy to fill out DMV forms. Depending on your state and your region, you may also have access to transportation services for patients who cannot drive themselves. For example, dial-a-ride or access services, but that's very regional, so you'll have to figure out what's available in your area. And then occupational therapy. There are occupational therapists who are specially trained in vision rehabilitation, and they can help with things such as eccentric viewing training, scanning training, and also in-home evaluations for safety, lighting, and labeling devices. And a couple more referrals that we might make if the institution that the patient is at does not have all of the devices for additional clinical testing. We can certainly refer out for that. If the patient needs genetic counseling, or it's been a couple years since they've had genetic counseling and they have additional questions, we can refer for genetic counseling. And last but not least, we can refer for clinical trials.
Thank you.
The Best Clinical Practices for Patients with Inherited Retinal Diseases webinar provides a holistic approach to the care and management of patients with an IRD. To view the webinar in its entirety, or for additional resources for your patients with a retinal degenerative disease, please visit www.fightingblindness.org. You can link to our professional outreach page by clicking on the Eye Care Professionals tab in the top right-hand corner. Thank you for your time and attention. This is Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness.